To this now, consumers are being tricked into buying fake sanitizers during lockdown. The sanitizers, which have fake seals of approval from the SA Bureau of Standards, pose a risk of catching fire and triggering allergies. The Bureau says it's noticed a definite increase in the fraudulent use of its mark on packaging. And joining me now to unpack this is SABS lead administrator, that's Jody Scholz. Jody, thank you so much for joining us. Are you telling me that the amount of sanitizers that I've been seeing from social media, almost every other company is selling sanitizers, could possibly not be SAB approved? They could possibly, not even be complying with regulations around, a sanitizer of standard.
Yes, good morning to you and your listeners. Unfortunately, that is the case. We've noticed an increased amount of unscrupulous products hitting the market and that don't bear the approved SABS logo. So yes, it is a concern for us that substandard products are entering the market.
Do you think consumers at this point can tell the difference or are educated enough on what is a fake product, what's not, or at least what is an SAB approved product or not?
We've got some guidelines on our website. I think the easiest things are to, when you're looking at the actual bottle of hand sanitizer, it must have the full name and address of the manufacturer, the company registration number. It's got to indicate what type of hand sanitizer it is. Is it liquid or is it gel-based? The percentage alcohol that's used. It also must indicate the general conditions for usage. So I think if consumers just look at those few items, you would then be able to indicate which sanitizers are approved by the Bureau of Standards or not. It must also have the SANS, so it's the South African National Standard 490, which is the standard that is applicable to hand sanitizers. It could also be matched with another SANS, which is the SANS 1853, which indicates it's for general use in the food industry.
Yeah. So, Jody, I mean, most times when we go to the supermarket, the stores, retailers, before you enter, you have to be sanitized. It's quite a precaution that they take very seriously. But most times this is just a bottle with no labeling, no packaging. And, there's an insistence that you need to do it quickly because there's a queue and make sure that you are protected. So can consumers then also question before they enter any office space, any supermarket, any retailer as to whether or not that is a safe enough sanitizer to use?
Yes, they can do that.
And also, just in terms of the dangers then associated with using fake sanitizers or those that are not even approved, what are some of those dangers you can make us aware of?
So I think the main ones are around skin reactions, eczema, cracking, burning of the skin. What we're finding is instead of using ethanol, some manufacturers are using methanol, which has adverse reactions on the skin. So when we're testing any products as a hand sanitizer against the 490 standard, it also then indicates a skin test. And so, you are able then to determine what the adverse reactions are. But burning, eczema, itching, those are the common reactions that one gets.
Any way that the consumer can report a suspected fake sanitizer?
Yes. So we've been working very closely with a number of regulatory bodies, most notably the National Consumer Commission. So from a consumer point of view, where there is a valid complaint, and we have referred this to Commissioner Tezi Mabuza, and she has gotten a team on it very quickly. It's been across provinces in the country. They then actually have the mandate to go and seize a particular product and then refer that product for testing. So there's been a lot of cooperation with the local SAPs, with the National Consumer Commission, with the National Regulator for Compulsory Specifications, as well as with SAPRA, the Health Regulatory Authority.
Yeah, and because we're having this conversation, surely you have, heard or received at least some of these complaints or cases being reported. What are then the repercussions for anyone selling a fake sanitizer?
If they are a SABS mark holder, and we've got on our website, there's a list of 24 manufacturers. So consumers can look at those manufacturers and contact them and purchase approved sanitizers from these companies. What we also do is when it comes to the SABS mark, we enter into a legal process. We issue them with a cease and desist letter, and we ask them to remove the SABS mark. Where it's a consumer-related product, we would then invoke the National Consumer Commission or even SAPRA.
All right. Well, Judy, thank you so much for highlighting this issue for us. I think at times when there's a pandemic and there's so much panic, anyone can just use any sanitizer and think they're perhaps protecting themselves, but they could potentially putting themselves in further danger. So thank you so much for bringing this to light. That's Jody Skolsley from SABS.